Welcome to everyone. I'm Magistrate Spencer. I'd like to first acknowledge the traditional owners of the lands on which we all are joining from today. I'm on the land of the Wurundjeri people of the Kulin Nation in Nara, Melbourne, and pay my respects to elders past and present, and any Aboriginal and Torres Strait Islander people who are with us today. It's my great pleasure to introduce Dr. Francis Acquah. Dr. Acquah is a qualified and credentialed mental health nurse, accredited by the Australian College of Mental Health Nurses. He's got over 25 years experience working in youth, adults, public and private healthcare in Australia and the UK, and worked in clinical, managerial and education roles. Francis has a keen interest in transcultural psychiatry, and his clinical practice includes psychocultural counselling and advocacy for refugees and immigrants within the African community in Australia. So it's a really great pleasure to have Francis with us today. Over to you, Francis.
Hi, good afternoon. And it's a great pleasure to be here to share some experiences with you. I also like to acknowledge the traditional owners on the land we are meeting. I pay my respects to their elders past, present, and emerging. I am in Kaukalo, in the northern suburb of Melbourne. A number of people who may not know Kaukalo is just 45 minutes from the CBD. And I've opened a wellness center here. In fact, it was a fantastic Melbourne weather for Saturday, but I'll share more experiences around there. So I think what we're going to do is a questionnaire format. But before we start, I would just like to mention, for the younger people, they may not even know Lorando, but I work in Lorando Hospital, next to La Trobe University in Bandura. I've been on the first CAT team in the Austin Hospital. I've worked in the pharmaceutical industry in the year 2000, the Millennium Night, people may remember. I've actually worked in Origin Youth Health, changing from EPIC, the early psychosis unit, to becoming Origin. I've worked at MRC. I've worked at Parkville. And in fact, I spent the whole 5 months in the youth in Barwon prison with the youth there. So what I'm going to offer is things about practical experiences. And I would say I have been there. And what I'm going to talk about is a lot of it is Francis' experience. For example, I went to the Mental Health Royal Commission and I used the words that a system is broken. And at the time, I actually had a foundation, which was called Mental Health and Wellbeing Foundation, which I should have painted it and sold it to the Victorian government. But that's Francis wearing his own hat. So I'll be talking more practically about my experiences, and also I'll be happy to give some controversial suggestions going forward.
Thank you, Francis, for that introduction. So thinking about the experiences of young people, there's young people who come from Africa to Australia, who've experienced various things in their journey before coming to Australia. And there are a lot of African Australian young people who are actually born here and growing up here. Maybe thinking about the first group, what are some of the issues that you have seen in your discussions and your meeting with young people for that group who are coming to Australia in their youth, and what are they experiencing in terms of their social and structural issues confronting them, as well as their psychological, mental health and well-being?
So the first issue that comes to mind is around people going through the refugee process. Unfortunately, a lot of families spend years, minimum 4 to 14 years in refugee camps before they get accepted. Australia has been generous to accept a whole lot of people over the years. And even if I cast my mind back, the reason why I started specializing in this transcultural mental health area was when we started receiving people back in the late 80s. I came here in 86, the late 80s, and obviously the early 90s when people were arriving. But the difficulties for the families were, how do they settle into a new culture? I will give you one quick example of Royal Park Hospital, which we had the Commonwealth Games there. It's now a housing estate in Parkville, whereby somebody who has come off the plane arrived and was psychotic. So she was sent to the Royal Park Hospital, and she was refusing to eat or to sleep. She was standing in the corner of the bed, in the bedroom. And eventually I was called from Lorando to Royal Park to say, what can we do with this person? And my simple answers were, oh my God, this person, you've given this lady a bed. Now, this is a mountain that she's going to climb. She's never slept in a bed. What about if we put the mattress on the floor? She won't have a shower. My God, what's this thing? Rain coming from the sky. What's gonna, food. Those days, we only knew about mashed potato and two veg. And we're giving her fork and knife. What is she going to do with that? So I changed the simple thing about, let's think outside the square. Let's put the mattress on the floor, give her some food that she can eat with her hands. And honestly, I'm not boasting, within 24 hours, this lady was almost cured from doing the practical things. The youth have come through where the families has gone through intergenerational trauma. They have witnessed a whole lot of things, displaced. Again, we were generous. And I would say Amanda Funston was responsible for some of that in the sense of there were a whole lot of youth who came here without family support. Or for that matter, there were a whole lot of family who were here with strangers. They were put together. They were not part of a family. They were part of a family, but they were not natural families. So cousins, children, or children who were from the refugee camps were put together. Excuse me, mother, you are responsible for them, and then you bring them to Australia. So these people have been affected, their mental health have been affected, and then they come here. The issue then starts. A single mother with 7, 8, 9, 10, 11 children, how do they look after them? How do we support them? There's the normal adolescent growth, adolescent issue that sadly, these parents are single parents. There's no fathers, or there are no partners to control their children. And therefore, things start to degenerate there in terms of their mental health, but also the societal responsibilities, stigma, cultural differences, understanding even the daily bread. Where there are fathers there, their qualifications are not accepted in Australia, so they cannot work in that area. They cannot get jobs. they all start relying on the state for every resource that they need: accommodation, funding. Unfortunately, the children end up looking at other people. And so my friend is wearing a Nike shoe. How do I get a Nike shoe? How do I get the brand that other people are getting? Sadly, the other part of it is, how do we access services? As I've mentioned, I actually work in Origin Youth Health for 5-6 years. And I will say, I never saw a young African person coming through the front door. Unfortunately, when I go in and I go onto the ward on a Monday morning, I'll see an African youth being admitted, but not being admitted by his or her own will. They come in through involuntary with the police. Their mental health have deteriorated, and therefore they're coming in forcibly for treatment. When they come in forcibly for treatment, the issues are, it's too late for the families to engage with these young people. So what do? They don't get visitors like everybody else. The families don't want to even discuss it within the community that they've got somebody with mental illness. Mm. We know that people have even left the state to go elsewhere because their children or their child have become mentally unwell. So what happens to these young people? They go on the streets. And the next thing, they come through the justice system.
So, Francis, what are some of the barriers and what might we do to make our services more accessible?
Well, like I said, I'm going to be controversial. And sadly, the court systems and the health system don't have enough Africans working as the front line to engage with these young people. Mm. So I'll just give a quick example. Having worked in with the youth in Bowen prison, especially, the youth also have what they call their rights. So they're supposed to have mental health assessments on arrival, and they will refuse to have assessment done. Now, while I was working there, I was working afternoons, and I will go there and they'll say, oh, we've had 2 or 3 new admissions. And I'll go and check whether they've been assessed. And a lot of them will have their assessment sheet reasoning refuse. But I decided, no, I don't accept an answer for refusal. So, excuse me, magistrates, I will put on my hat. I usually have a red hat. I say, this is Uncle Francis. He just wants to have a chat. Uncle Francis will then go there and sit with the youth. And eventually will say, one of you, can we have a bit of a chat? When we start having a chat, I don't have a pen and paper. I will go and sit in the private room and just have a conversation. How's your sleep been? You know, what else has been happening for you? Are you happy with the food? Etc., etc. By the time I have that conversation, I have been able to collect enough information about their mental health. Mm. Now, this becomes a jealousy issue because somebody else will say, why are you talking to Francis? And why, the next thing, I have a queue by the door. Everybody wants to speak to Francis. Mm. And then I will do the assessment and go back and write it up. That's the engagement.
So you're building that trust and that rapport that doesn't exist with the system.
Absolutely. Mm. Yes. So we've recently started working and we're doing the Project Sunrise, which I believe a lot of the team there have heard of Project Sunrise. Project Sunrise is a drug and alcohol program which has been funded by the Victorian government as part of the Victorian Action Plan, of Victorian African Action Plan. And it's African-led, but we're in a combination consortium with Odyssey and YSAS. And we provide direct interaction with the youth. One of the programs that we are following up is a group of young people hanging around in St. Albans. Now, it took us good 4 or 5 months to actually start engaging the youth there. And we discovered that it has taken us this long to actually get their real names and their phone numbers, because they needed to build the trust for us to then engage them. They have a plethora of difficulties, but the system there was actually just calling the police, putting a lot of funding into surveillance cameras, and really notices to say, don't drink alcohol at the place. Well, what happens? The police comes, they want to enforce the law rather than assisting them. Now we are engaged with these people. We are looking at the issues around their mental health, their drug and alcohol issues, and a number of them are volunteering instead of compulsory to go for drug and alcohol rehabilitation. So that's why I'm calling for a proper system, engage. Now, my controversial statement here also is about how do we use some of the funding the appropriately resource. So understanding we are doing drug and alcohol, but I believe that we need an African-led mental health program to help to assess and to support the African young people. One of them will be something like even mental health first aid. Now, the amount of money that is spent on just one person, if we are funded enough for mental health first aid, we could go in and educate not just the community, but the African young people about their mental health and how to get appropriate help and how to get help early.
Francis, you touched on before what appears to be some shame and stigma around mental health, or the way that mental health is perceived in community. Can you explore that a little bit deeper for us?
Yeah. So as we started off, I've actually been to Ghana to actually been doing some work there. And for me, I've been out of Africa for more than 45 years. But when I got to know about still how mental health is treated in Africa, it's still the same that was being done hundreds of years ago, whereby people get left until they are really semi-naked walking the streets. And therefore, people actually shun mental illness. And they believe that people are possessed by the devil, demon, people's families have been cursed, and therefore. So it's a strong taboo and stigma attached to it. So people don't want to relate to anybody who has mental illness. In fact, in some cultures, they will not even marry or engage somebody who says they've had a mental health issue in their family. And this is what people are still carrying and bringing to Australia, that, of course, mental health is taboo, and therefore people don't want to talk about it, don't want to seek help. But the sad part of it is that they don't even know how to get the help and where to go for the help. And for people who may even want to go, they will say, excuse me, I can see a lot of Caucasians here, but I'm going to be controversial. I'm not going to go and see a white person who doesn't understand my culture. I want to see somebody from my own culture who can understand. I have been to Ghana recently and just come back. And within 2 weeks, I attended an outdooring or christening I've attended a wedding, and I attended a funeral, all within a short period of 2 weeks. Because I was there, I'm expected to be part of these ceremonies. We are losing those sort of things. And therefore, here, we don't even understand, or we don't know who to talk to. How do we engage with our uncle, our auntie, or a member of the community to even get a support? Say, oh, my son is not doing well. He's not sleeping at night, or he's awake all night, and therefore not engaging with any activity. There's nobody I can go and talk to. Unfortunately, people start self-medicating, and self-medication is drugs. So, a friend says, if I smoke marijuana, I feel better. But that then starts to perpetuate the disorder. And from marijuana, it goes to the next one. And we all know, I usually tell the young people, ice is poison. And we don't know even the formula for that. So once they start getting there, the next thing is, how do they start to feed those habits? Feeding those habits, it means that they have to get some money.
So you're talking about that, how to talk about these issues. We have, young people in the children's court and adult court, young people coming before us. And, it's hard you can see that there's substance abuse issues, that just hearing their stories, that there's likely trauma. There may be actual mental health issues that have not been yet diagnosed. How would you suggest, in our short moment when we have a time to connect with someone, how might we talk about those things in a way that might at least open the door to a future engagement in a service, and a way to break down some of the stigma and shame around those things?
So I have been thinking about this, and I have two good suggestions. I think all the lawyers and probably all the staff within the justice system should, and I'm using the word should, undertake some mental health first aid training. It's a 12-hour course. There are blended courses around, which could help people to understand at least that first part of the engagement. And therefore, when you notice something which is not going well, then you refer them to the appropriate services. That's the controversial part of the issue, is where are the appropriate services? Now, I have been doing this and talking about this thing for donkey's years. I organized the first mental health engagement between the African community and professionals back in 1989. So you can see what I'm talking about. But when we come to reality of getting the funding to do the work, the issue is the funding gets given to the big boys. Origin Youth Health, Jesuit Services, Core Health. Now they get the funding to do what? Zero. And the African community needs support in actually starting to engage. Let's look at it in the sense of what supports are being given to our First Nation people now. Having the drug court, having a system whereby even at the point of arrest of a young person, we should have something like an African advocacy group that can be called to be there.
Could you explain a little bit about the impact of trauma and how that might manifest in people that we're seeing in the court, in terms of the sorts of behaviours and symptoms that we might be seeing?
So, as I mentioned at the beginning, this I will call poor dysfunction families. that have arrived or have come here, and parents have become single mothers or broken homes for that matter. There's no actual support. When you assess them, you will realize we have children, 5, parents have 5, 6, 7, 11 children. How do you support that number of children to start off with? The trauma that has been carried, the behaviors that the parents have actually witnessed starts to impact on the children because of we don't have corporal punishment here. So they can't discipline the children. If you try to discipline a child, they said, well, I'm going to call the police on you. And so they can't do anything. Those sort of things starts to manifest. What happens? It affects their schooling. They go to school, they've fallen behind. They can't. Of course, it's easy in primary school. The problems then becomes when they arrive in the secondary school environment, the problems just continue to manifest. They get arrested. I've mentioned the word stigma. They can't get back to school any longer. They're falling behind in school. Parents are not able to control them. Our curfew system, the bail system, first offense, and they immediately get bail. But then their conditions attached to the bail to say they should be home by 7 o'clock. Please, how many children obey that type of bail condition? So what happens is they get bail, they get out, they refuse to support the bail system by going out with their friends. They get arrested, and then they have multiple charges. They don't get properly assessed, as I've mentioned before, even within the system itself. Your magistrate, your honor, I have seen reports whereby there are 20, 25 people involved in the care of the young person that has left the prison system. But when you go back and look closely at the document, they said, oh, requires mental health support. When they come back, they never attended any of that support. And like I said, the young people themselves says, I'm not going to go and see a white person for this or a Caucasian for that. So we need a system that will allow us to engage with them. I've just today talked to one of my Project Sunrise staff and said, we are getting overwhelmed. We need more resources in this area. We need more staff. So unfortunately, because of the funding, one person is on leave. The 2 people now have to carry the whole state, literally, in managing. So we need resources in this area. We need to be able to, not just in the court system, but we need to look at preventative programs within the schools, within the workplace. How do we support the families when they come to court? Who supports them?
So, Francis, I don't want to overwhelm you with referrals now after what you've just said, but Project Sunrise, it's a drug and alcohol program, and it's can you tell us about what the catchment area is and how people access that service?
Yeah, so initially we were looking at about 9 cities within Melbourne, but really we are covering the whole of Melbourne. We have staff working directly from NJC. We have staff in Footscray, in the northern suburbs, and also in the Dandenong area. So I don't have the number directly with me, but you can contact us directly, and we are engaging with the communities. but we're also providing education to the community about the resources or how to engage with services as well.
So it's an education program, or it's it provides direct alcohol and drug services with Odyssey and YSAS?
Yes, it provides direct care as well. And not only our staff engage with that, but also using it as a referral source for treatment with YSAS and Odyssey as well, and inpatient care as well.
Okay. We'll get some information to circulate to our court support staff. We've had a question in the chat here from Lakesh from our Victims of Crime Tribunal, thanking you for your insight into what goes on behind actually engaging, that building of rapport. And the question of how do you balance the reporting and KPI deadlines, like the time that you need to take to actually actively and genuinely engage with young people?
So these are part of our arguments, and we keep talking to the states about. As for us, it's not even about the numbers, but it's about what we do and what we are doing to make a difference. So even if it's going to take a whole year to engage one person, it's more important. Like I said, I've had a chat with one of my staff today, and she was saying that she's been seeing this person for the last 6 months or more. He's just got into long-term drug rehabilitation for 5 to 6 months. And the father, who she has never spoken to, but has been in the house when she's been visiting, called her today or yesterday to thank her for engaging with his son and for finally agreeing to go for a long-term rehab. He has been into short-term rehab. So these are I've told her to get a testimony, but these are the things that we want to be able to do the difference. It's not about the KPIs. I don't want to speak too much about my center, but I have been talking about, mental wellness. And I've just opened a center in Kaukalo in an 1860 built church right behind the Kaukalo Hotel. But I'm changing the paradigm of mental illness to mental wellness. So we will have things like a basketball court here. We'll have a garden, from the garden to the table. A client of mine has donated a pizza oven. We're going to learn how to make bread, different type of bread. I've got a bicycle donated to me on Saturday. We'll have activities. People will come in and take a bike for a ride. We'll have activities, meditation, yoga, Pilates. People will come in and volunteer their time. It's a sustainable activity, doing a garden, etc. One of my other controversial statements is that, we need to have something like even a boot camp for these young people so that they can learn some of these skills about, I was a Boy Scout, doing camping, living even outside the city to know the basic things which we are losing. We're all spending too much time on the on the computer, and then we go out and we offend. We need to change those sort of thinking about what is useful and what are the things that we can do to help ourselves.
It sounds, Francis, that this broader conception of well-being, as opposed to just talking about someone's mental health, may be a way to proceed, that to think about what is the person doing with their time, who are they, what activities are they involved in, who are the people surrounding them. Is that a way that you found an in for the young people to start talking about these issues that is a little less stigmatizing?
Absolutely. And one of I call it the wheel of life. How do we balance our life? We have our families. We have no choice. We just belong. We have relationships, very important. So I'm in Kaukalo. My next door neighbor is the hotel. They gave me a $50 voucher for, for my raffle ticket. I have to build a relationship with them. How do we look after our health? Our health from the tip of our toe to our head to our toe. Our mental health is there. So how do we support that? And as I know, I said, I do things overseas. And I said, in Australia, our first point of call is our GP. So even then, we need to have our physical health checked, but then we then have to look after our mental health. How do we support our learning? In the last 4 years, where are your masks, people? But we had to learn to use the mask. Sanitizer. We had to learn to do that. Maslow hierarchy of needs: housing, food, accommodation. In fact, one of our winners when we are engaging with the youth in St. Albans is that we do a barbecue, and that attracts the people. We eat together. We support vacation, recreation. How do we do some of those things? The means of, I'm sitting in an old church, but means of spirituality. Who is Francis? And what does Francis stand for? Today, I'm not too bright because the weather wasn't, but I wear my African clothes and I come to court in my African clothes because I'm very proud of those sort of things. How do we get the youth to engage in their culture? Unfortunately, those are the things that they are really missing out on because they can't call themselves Africans, they can't call themselves Australians, and therefore they fall in between. Issues of discrimination and racism. How does that affect them individually? They're late to school, but the words that will be altered to them just so discriminative that they don't feel the need to come back to school because they will be told off or they're not wearing the appropriate clothes. Or how do we re-engage with them?
Yes, I've got a question from the audience, Francis. Anita asks, what can we do in the area of prevention for parents and very young children?
Well, actually, somebody just sent me about what is affecting young people's mental health that is being overlooked. And those are the things that, again, if we can think back about some of those preventative things that I think, how do we educate the community about mental health? Where do they get support? How do they understand? We are hearing that a lot of people are missing out on the NDIS, for example, because they don't understand what is there and how to get support. So there are children who are experiencing ADHD, autism, get put in the hard basket because they are failing in school. And once they start failing at school, that continues because we go by their age group and therefore they get promoted. And then as soon as they hit the secondary school, totally out. So those are the things that we need. And like I said, if we know that there are African-led services that we could easily refer people to, they can receive the holistic and comprehensive assessment like anybody else, and then things could be addressed early. So those are the things that I'm challenging the system. We have talked about the Royal Commission into Mental Health. And like I said, I personally went there under the banner of Francis Acquah to advocate for the court community in general, for places for them to be able to go and feel comfortable that they can receive assessment and they can receive the appropriate support.
I've got another great question actually from Justine. In the pressured court space, can we introduce the potential of hidden mental illness issues by using language and concepts of mental wellness? how would you suggest we raise this topic without triggering stigma?
Absolutely. In fact, I can share it. I did a conference in Ghana recently, and the presentation, which was actually done from Australia by Every Mind, the Australian leading mental health suicide prevention organization, talked about language. How do we change the language? And the most interesting part of it is that the whole conference was changed around that. And people started using a different language. In short, one of the programs that I'm also keen to bring to Australia, I'm an international instructor, is called RAP, Wellness Recovery Action Plan, RAP. And it has been done in the US, but it's been introduced to Ghana in the last 5-10 years in the prison system. It started off with prison officers and now the prisoners. But more importantly, they are researching it. And in the presentation at the conference, there were more than 30 prison officers attend the conference, which I organized from Australia, but ran it in Ghana. And they said the ex-prison prisoners are coming in and actually running the program. So these are conversations that I would like us to explore further. How can we change that language for everybody? And how do we support those people? We need resources. And I'm going to be at a controversy and say, we don't have many Africans even within the justice system that could actually help to assess these young people to feel comfortable when, and they can give the relevant information. I could come and sit in front of you and just talk about what you need to know, but we want to be able to capture what they need.
Excellent. Are there any other questions? Does anyone want to just pop up their hand?
Sorry, Magistrate Spencer, I've tried to pop up my hand, but I don't seem to have that option. So if I could just jump in.
Jump in.
I just wanted to make a statement about in support of that idea of the need for a diverse workshop, and also comment about the fantastic work Project Sunrise does. We have 2 Project Sunrise workers who are embedded at the NJC. They come in on different days, they alternate. And just as an example as to the some of the response to them, Heather told me after she'd been here a few months, she connected with a young local woman, a local African Australian woman who needed her support. And that young woman referred 14 others directly to her. And if that doesn't scream the need for a diverse workforce, I really don't know what does. So just a big shout out to Project Sunrise. They do great work and we're really fortunate to have them at the NJC.
Well, what else can I say about this?
Can I ask, is Project Sunrise, will that be evaluated and with the view to promoting its good work and seeing if it can get more funding? Because it seems that if it is something that is working, that we have other, definitely across our court system, access to such a program.
Yes, it's in the process of evaluation. In fact, just this morning, I've just sent an email to Deakin University to see if they can come on board with. I have been using Newcastle University because they've been our support, but definitely. The other, shout is that, we are quite ready and prepared to do joint things. And I usually, my national anthem is don't work in a silo, and I don't work in a silo. And so we want to be able to collaborate with other services and offer practical, sometimes we get invited to be part of committees, and you go there, you spill your guts out, and the next thing, you don't hear anything or you are not included. An example during the COVID, I went directly to Flemington, and I said people wanted to speak about their mental health in their own language. And that's something that is important to also recognize. Sometimes people feel more comfortable and more fluent in expressing themselves in their own language. While I would say I don't speak a lot of the languages, I go there, I usually say, I go in with patients to psychiatrists to interpret English. To interpret English, because sometimes the clinicians actually don't even understand the nuances that the system is actually talking about, but also the client. So sometimes there's that need for that mediation. And the more we have people, then we can understand the young people. We can do a lot of the preventative work, but also the system will also understand us.
Yes. One last question I have from Brendan, who works in our Court Integrated Services program. Are you aware, or Project Sunrise aware of any African Australian culturally appropriate supports in regional or rural Victoria? Always a challenge.
Well, as you know, Victoria ran out of money. With Victoria ran out of money because they were looking at some regional places. We personally, Positive Wellness Recovery Center has an office in Shepparton, and we are engaging to do more things. But they were looking at some funding to regional areas. And if anybody has direct contact with DFFH, please talk to them about it. We are ready and willing to look at the regional areas. They did come to us about regional. Unfortunately, the budget didn't allow that. So we don't have, but we are quite prepared to do that. We are also doing something in Cranbourne, which we call it NAS Recovery Center, to allow especially young Sudanese people to come in to be part of a drop-in center that they can undertake some activities around. Again, we are using the word wellness, and by using that wellness approach, they can experience different type of things, like I said, yoga, Pilates, and the well-being activities. Going for a walk. What do you do? How can you engage? There are lots of people who are actually, and I can't talk more about my own mental system, but people who are lonely within families. How do you engage with those people? And this is what I am also doing here in Kaukalo, is a center where people can drop in and undertake and participate in activities. So yes, definitely.
Definitely a need. Just so people on the link know that together with Sarah Maher at the Neighbourhood Justice Centre and some magistrates who are working in various courts across the state, we are doing a mapping exercise of organisations who are working with African Australian people in Victoria. It is patchy because of the funding that isn't available, but there are some really great community organisations doing some good work. So we are mapping that, and we will be sharing that with local court support and specialist courts teams, so that you and your local magistrates can start making some connections, if not already. In fact, some of you are already making those really great connections. So
Can I give one quick example of what happened in Shepparton? One young man was referred to me initially. He's had a Caucasian girlfriend, and they got into stouts, and anyway, the police was called, intervention orders were put in, etc. And I engaged with him. A few weeks or months later, a lady was referred, completely different name, and we gave appointment, but they said, oh, it's actually the couple. So my colleague, who is a social worker from Kenya, took on the lady, In fact, she spoke the language. I didn't speak any of the language. I gave him an appointment. He didn't come to the appointment. So anyway, we decided to do a home visit. And this is another part of our service that we do, is the outreach. So we went to investigate. The couple had different names. The address that was on one of the 18 was different to the other address. So I went to the boy's house. Oh, it's the father. When we check out, actually, it's the mother. And the mother and the father had been in a domestic violence issue. We engaged with them. The father actually had called the police because the mother wouldn't give him enough money to pay the rent or something of that nature. Anyway, to cut a long story short, our intervention, speaking to the father and educating him, hey, if you work, in fact, you will get more money rather than relying on Centrelink. You can get your car. You can do that. Culturally understanding the Australian system. The mother understanding the father, where he's come from. The rest is history. But that was just one example of us intervening. Otherwise, he would have probably got not to work, demanding money every day from the wife, getting into more difficulty. Intervention order will become, he will be kicked out of home, and the problems will just continue.
Thank you, Francis. I'd like to thank everyone for joining us today. You can do a virtual round of applause. It was very enlightening. I think the things I'm taking away is that there's certainly experiences that mean the African Australian community have challenges that need to be supported, that they need to be supported for, that there are some barriers to accessing service, particularly the stigma around mental health and some very real structural barriers. And in particular, the lack of culturally appropriate services. But there, while we wait for change to come, because we're patient people and we keep looking for the expansion of great programs such as Project Sunrise, there are practical things we can do now about, I think you've given us a way of talking about these issues with people that may try to focus on the wellness and well-being rather than mental health and mental ill health. The need to really focus on practical things, being very practical and helpful in our interactions and building that rapport. Where possible, connecting with African Australian communities and the leaders within those communities to provide that cultural support and that link, so that the conversations that mainstream workers can't have can be held. And we definitely need to, all our managers who are on the line, to be keeping an eye out for increasing the diversity of our workforce. So definitely work to be done, but great start to a conversation, and I hope we can continue this conversation, Francis.
Thank you so much.
Thank you everyone for joining us, and look forward to inviting you to our next Consider This.